Well, welcome to this UK drug testing and drug testing kit product demonstration for the new Ultra Ketamine Saliva test kits. Just being launched into the UK by UK Drug Testing. The elements that are provided as part of this test are shown in front of you here. You have your Ketamine Saliva test cassette. This is the sample well indicating 3 drops of saliva should be added, and this is the results window with a control line and the ketamine line for the results interpretation clearly identified. There is the sample collector, which is effectively a sponge on a stick, and this is a very clever device. Your pipette actually is in the lid here when you come to dispatch that. And then there's the sample saliva tube, which is used to squeeze the saliva out of the sponge into the base of this collector, which can then be inverted and used as a dropper. So those are the 3 elements. To do a saliva ketamine test, it's very simple. You need the donor that you're going to screen not to have eaten or drunk anything for ideally at least 10 minutes. No smoking either. Ideally 20 minutes if you can manage it, but 10 minutes is fine. And then you ask them to move the tongue around the mouth, licking the inside of the top and lower teeth, the outside of the top and lower teeth, and then to lap across the bottom of the mouth towards the front teeth and up towards the top of the front teeth about half a dozen times, and that will create a pool of saliva in the mouth. You then ask them to introduce the saliva swab into the mouth and let the swab go completely soft. When it comes, it's not rigid, these swabs, they are quite soft in themselves, but you want to completely saturate that in saliva and then ask them to move it all around the mouth again, top and bottom, front and back of the teeth, gums, cheeks, top of the tongue, and then take about 2 minutes to completely saturate it in saliva. So we're going to do that now for you. Now, when the saliva swab is completely saturated with saliva, it takes about 2 to 3 minutes and been completely worked around the mouth. You then remove it and insert it into the saliva tube in an upright position, and it should squeeze down and lock into place. You just screw it down, and there you have, you see here, quite a large volume of dispatched saliva into the base. You should be able to see a good 2 or 3 mils minimum in there. And then to run the test, unscrew the blue cap on the collector, invert the tube, and simply allow 3 drops, which will come quite naturally, as you can see there. There's no need to squeeze with this actual design. It just feeds into the sample well. And at this stage, start your timer, and you're looking for a test which will run over the course of around 10 minutes. So we'll come back and show you the results. On this test, you can already see a little bit of the pink dye starting to flow up through this membrane. We'll show you the end result at the correct read time for this test, which is between 8 and 10 minutes. Well, this test has now been running for the allotted time period, and you can see clearly that we've got a nice dark control line by the C line as indicated on the side of this cassette, and we've got a test line showing. That means this is a negative test result. A positive test would be indicated by a control line with the absence of a test line showing at a full 10 minutes development time. If no test line develops and you've got a control line, you must allow a full 10 minutes for develop. If you have got a control line and a test line showing earlier, then that's not going to change and you can interpret it as a clearly negative result. The cutoff for a positive test result on these tests is 30 nanograms per mil. So these are an ultra-sensitive ketamine detection test for saliva, and the accuracy is in the order of 99.7% compared to laboratory screens. So that's how to run our saliva ultra test design, saliva collectors and test cassettes. If you've got any questions, please pop them in comments or contact our customer service team, and a link to this product, which is now available on the UK Drug Testing and DTK websites, will be in the description below. If you need further details, please click on the link and follow that to the website listing. Thanks for watching.